One of the most challenging yet sort of fun and exciting parts about being a physical therapist or an injury rehab specialist is where to begin with that person who comes in with pain, and then how do you get them out of pain? Because eh, the paradox of what we're trying to do is someone comes in because moving hurts, and then we give them movement to solve their problem. So we're giving them something that hurts, but we need to find a better solution or a better strategy to teach them how to do that without pain. And knowing where to begin. So, a graded exposure approach to getting someone out of pain is the best way to handle the problem because it works at a level that their nervous system can tolerate and that psychologically they can process what's happening. And that's a huge component of pain, especially because we know how subjective and individualized really a pain training treatment program is. So, my name is Jim Hefner. I'm a doctor of physical therapy and an orthopedic clinical specialist. And we're going to talk about how to train someone out of pain and where to begin with that. So, when someone comes in to see me, we need to first they tell you that something hurts, some daily activity or exercise hurts, and then we need to identify what's the cause of that pain. So, what are some aggravating and alleviating factors for somebody? Then we need to identify what motions are required for that painful activity. And that's where we go from the subjective lens where they tell you what hurts to our more internal clinical objective lens of what are the biomechanics that are happening that are feeding into why they're what are the biomechanics and potentially situational psychology that are feeding into why that hurts. And then lastly, we need to give them something to take care of that problem. So we need to start them at a point that doesn't just flare up their pain worse. And the way to do that is to put them in a position that gets them moving towards their goal, but that it doesn't flare up their symptoms in any way. And it's at a level that their nervous system can trust and can tolerate. So that's where we need to start our treatment. But knowing that we have to be thinking back and back on how, this is causing pain, but this is where we need to start for you to build that back up. And that starting point is going to be different for each person based on their irritability and level of injury, etc. So, in action, when someone comes in, let's say what movements or activities are painful. Well, someone might say their right front of their knee hurts, anterior knee pain when squatting or lunging. And let's say for this example, it's lunging when that right leg is back. And so we often think about a lunge as the leg that's forward, but in this example, we're saying it's this leg that's back. And that's important because the specific movements and the specific positions that are causing pain are going to influence where we start our treatment program from. So with squatting, the hip is flexing as the knee is flexing, and the quadricep is lengthening in a closed paint chain position. So I'm here, I squat down, my hip goes into flexion, knees are flexing as I get down. For a lunge, the knee's flexing, but the hip is in an extended position. The quad is lengthening on both of these, and it's a closed chain movement. What I'd be thinking about is what's the commonality there? Right now, closed chain thing seems to be hurting the person. Okay, so we probably need to do closed chain because that's where all of life happens. And in both of these situations, the quadricep is lengthening. So something about the quadricep lengthening is feeding into this pattern of pain. So where do we start? In this theoretical example, the place that would be a good place to start was you could say the person didn't have pain when they were able to do a hand heel rock or a hip to heel rock without any pain. So let's say it hurt to just do a full squat. Well, we're able to get them into all fours and then rock their hips back towards their heels. So mimicking the squat position completely, but without any pain is a great place to start. Now, for lunging, we were able to do an assisted lunge. So a position that might say the TR, holding on to the TRX, then they're able to lower down and get back up without any pain. So using some assistance from their arms, offloaded the demand through their legs, but still train their nervous system to do that movement without any pain. That would be a great place to start in this theoretical example. Now, there's quite a bit of background knowledge that you need to know that was fortunately built into a lot of our PT programs. And those would be, what are the various joints in the body and how those joints interact together. So we have, and then I simplified this just for simplicity's sake, of three main regions in the spine: cervical, thoracic, lumbopelvic, shoulder, elbow, wrist, hand, hip, knee, foot, and ankle. So 9 major joints that we need to be considering. And then there's 9 major body positions that we regularly go through. Now at home, people might not be going into prone very often, or they might not be doing a half kneeling position like I'm in right now doing this video. But these are the 9 positions that we regularly find ourselves in, or that we need to use to help tweak our training variables. Because let's say that person who's having knee pain can't go into a full lunge right away. Well, a half kneeling position and working on stability in this position, like I'm in right now, is a great way to work up towards the lunge, where the muscles need to practice being long and the other side needs to practice holding position there without causing any symptoms. So we got the 9 major joints, 9 major body positions that we might be in. And then there's 8 sort of functional movements that comprise the rest of all other movements. So if you have trouble sitting to stand, that's a squat movement. If you're doing anything split stance, that's going to be a lunge type of motion. The hinge is a hip hinge from the body. And that's a very strong movement that allows you to use your glutes and hamstrings. So all movements are going to be versions of these. A squat is a lower body pushing movement. A deadlift is a lower body pulling movement. So knowing these movements are going to help get you to what someone's functional daily goals are. If it hurts to go upstairs, probably some version of squat split stance positioning is going to be necessary, because they're going to be doing single leg loading to push themselves up. What we need to know as PTs and musculoskeletal experts is what variations exist for movement from a graded exposure standpoint in each of these. So if it hurts for someone to lunge, do a full lunge movement, well, can they go into a half kneeling position like I am? Can they do a stretch on the table and sideline that sort of mimic like a pretzel type of stretch that gets their joints moving in that position? So those are the things that I want you to start thinking about to know where to start or where to begin with someone's treatment program. A very important thing for me is, how are the muscles and joints working in each position that will then allow us to use our graded exposure. So where to start? Now, someone comes in with pain, and so we have to treat symptoms initially. We can't go from someone being in pain to loading them up with power and agility movements. It just doesn't work like that, because the nervous system doesn't respond that quickly. Now, we might be able to loosen something up and get them there, but a gradual training approach of taking them from a position of pain and then working on mobility and stability, and then into strength, and then into power and agility, is the safest and most reliable way to go from a long-term injury prevention standpoint. So let's say when someone comes in and it hurts to lunge, like that example before, we might say that person's right posterior chain is not kicking in enough, it's not doing enough work. So then when that person goes to lunge, they drop over to the side, and then that takes on more pressure through the right knee. Now, because of that, they lack some sort of mobility and stability at the hip to perform that movement. So then we could work on a bird dog position where they're kicking one leg out while the other leg is stable, mimicking that split stance position, but from quadruped. And then we could take them into a half kneeling position, again, like I am, and work on training different parts of stability from that range, working on the quad being in a longer position without them having pain during it. And then eventually we can get into single leg loading or skater type of movements, things that really require quickness and speed and timing. But we don't start there. We need to start in that gradual building the fundamentals up to preventing future injury. what are those variables that we can manipulate along the way? Well, if it hurts to do a full range position lunge, we can decrease the range of motion. We can change how much load is going through that person. We can change the body position on that load, where the load is relative to their body. We can change the plane of motion that something's happening in. We can change the level of stability that it's happening on, the frequency or intensity of it. So how often something's happening or how intensely something's happening. And then we can change the speed. So how, at what interval is this stuff coming at us? So there's so many variables that we can manipulate and work on. And we need to be thinking about where to start and how to get someone to where they need to go. If someone comes in and says, well, it hurts when I am running, and running is a kind of an explosive one leg bounding to the next leg, so jumping from one leg to the next. Well, let's see what their single leg stability looks like. And then let's see what a skater movement, a slow side to side movement looks like. Let's build that up into faster and faster movement. But we need to start smaller, slower, more focused, and then branch into more dynamic and uncontrolled new different ways. We also need to be thinking, so similar to before, and for range of motion, partial range of motion before full range of motion, bilateral before unilateral, stable before unstable, unloaded before loaded. So I don't want to put weight on someone's back before they can show me a pretty decent squat otherwise. Slow before fast, simple before complex. All of these functional progressions are things that we can tap into from a graded exposure standpoint to make sure that we're training people at a level that their nervous system can tolerate. And that is key. So where's the end of this? Like we are getting people moving and stronger and better and better. The end should be a combination of where that person's particular goals at, but because it's like we can't have someone do twice a day for the rest of their life. I can't be doing the 2 sets of 15 for twice a day for the rest of their life. But so where do we end with it? And the goal should be resilience. And we're teaching people to quickly recover from certain difficulties or challenges that their body goes through. We're teaching toughness for the tissues. We're teaching the ability to spring back from a position. So let's say I go into a single leg movement, I want to teach the ability to get out of that position. If I stumble and fall, I want to quickly be able to catch myself. Resilience comes from a combination of strength, power, mobility, stability, and quality movement patterns. So in conclusion, I want you to think about when you're working with people to use this exam flowchart of identifying the cause of it, identifying what motions are required, and then where can you start with a graded exposure approach. I hope you enjoyed the talk on how to help get someone out of pain and where to begin. And if you have questions, reach out to us on the Student Physical Therapist.